Welcome back. Well, if you'd like to extend another level of care to your patient and develop another stream of revenue for your practice, look no further than RySurg. I'm here with Dr. Reinison, and I tell you what, very impressed with this. This is not only really going to help the patient out there who suffers from this malady, but it's really going to help the practice develop as well and become known throughout the community as a way to be able to treat blepharitis. Can you tell us a little bit about the condition?
Well, blepharitis is a chronic condition that many patients suffer from. Up to 30% of our patients will have signs and symptoms of blepharitis. Blepharitis is an overgrowth of bacteria that occurs along the edge of the eyelid, among the lashes, and among the posterior lid margin. These excess bacteria build up over time because if you think about it, the margin of the lid is the only place on your entire body that never gets washed. Ever. We close our eyes, we can wash our face, we don't get soap in our eyes. It never gets washed. So over the years, the bacteria accumulate, dead skin cells accumulate, and the bacteria begin to really overgrow. And there's too many of them, essentially. Now, we'll never have sterile lids, but you don't want to have an overgrowth or an overaccumulation of bacteria there, because those bacteria produce endotoxins. These bacteria are primarily staph and strep. They produce endotoxins. So too many bacteria means there's a lot of endotoxins along the edge of the eyelid. And that was what causes the inflammation. And the inflammation is the real destructive force behind blepharitis. The inflammation turns your tear glands down. So if you're making fewer tears, now you have fewer of your natural antibodies, which are in the tears, fewer being presented to the lid margin. So fewer natural antibodies means even more bacteria, more endotoxins, more inflammation. And this chronic cycle sets up, a vicious cycle, if you will, and that needs to be broken. And previously, the only way as doctors we ever had to break that cycle of blepharitis was to send the patient home on lid scrubs and hope they could do it. And lid scrubs, as we all know, are very ineffective. Patients are non-compliant with it. It just doesn't do a good job at getting the eyelids clean. So what we have developed is a product called BlephEx. And BlephEx is a device that actually directly allows the doctor to clean the patient's lids completely free of bacteria, scurf, dead skin cells, and debris. So now the patient can leave the doctor's office with entirely clean eyelids. Now the lid scrubs are somewhat effective at helping keep the eyelids clean. But lid scrubs are never going to be effective at getting the lids clean, and that's the key. The doctor should be the doctor. He should treat the disease and get the lids clean, and then the patients can keep them clean. It's very similar to our teeth. We all brush our teeth, but we know that once in a while, twice a year, we need to go to the dentist and get a teeth cleaning, because our home scrubbing of our teeth is not 100% effective. It's the same thing with the eyelids. So the patient should come back every 3 to 6 months and get their lids cleaned again, but in the meantime, maintain their home lid scrubs.
Now, for the doctor, what type of learning curve are we talking about for the procedure?
This procedure is very easy to master, very easy to accomplish. It's essentially a handheld device. It's very ergonomic. It has an on-on button, and you simply hold it like you'd hold any other instrument, tool, or a pen. Hold the button down for 2 seconds, and there it goes. It spins. And you use that spinning sponge to clean the edge of the patient's lids, completely free of bacteria, dead skin cells, scurf, and debris. It's those dead skin cells and scurf is what allows an infestation of Demodex mites to occur. So if you can get rid of their food source, you can get rid of the Demodex. A lot of doctors also like to put a drop of tea tree oil in the solution that they put on this little sponge before they scrub. That also helps eliminate the Demodex. So the doctor takes a proactive role now in treating blepharitis.
So in addition to another level of care offered to the patient, this is another stream of revenue for the office.
That's correct. This is a private pay procedure. It's a non-covered benefit. Most doctors charge between $65 and $80 per eye, so $130 to $160 per patient additional revenue.
I would have to imagine that the patient's very willing to pay that nominal charge as well, especially to get rid of the redness and the swelling and the irritation.
That's right. They're having symptoms addressed that have never been addressed before. And economically, this procedure is less expensive than, say, a course of prescription antibiotics or any other kind of prescription anti-inflammatory, and they're actually getting relief this time. These patients report that as soon as they have this procedure completed, they feel relief immediately. And it's a very well accepted procedure. 95% of patients will say, yes, please go ahead and treat me. I don't mind the cost.
Well, Dr. Reinison, with that said right now, I know you have to have the attention. All of our viewers out there, what's the best way for them to learn more about BlephEx?
They need to contact our company, or they can go online at www.rysurg.com. That's RYSURG.com, and contact our company. Our phone number's there, and we can get our order form out to them, and they can begin to apply the new standard of care for the treatment of blepharitis for their patients. This is how we should all be treating blepharitis.
Easy enough. Doctor, thank you so much for being on.
Thank you very much. My pleasure.